Good morning, everyone. Welcome to Self Care Saturday. It's good to see y'all another weekend. We are actually going to talk today about taking care and loving your physical self. So let me add our co hosts, Laverne. Welcome, Laverne. I think you're muted. Unmute yourself if you are.
Good morning, everyone.
All right.
Another day of self-care Saturdays. I'm excited.
Yes, indeed. Well, before we get started, let me remind you who we are. My name is Latonya Brumfield. I am a coach at Always Up Coaching, and this is my co host, Laverne Wright. We're both registered nurses, health advocates, um, and we're going to talk today about self care. This is our second episode of our new series. But before we get started, I'm going to remind you to go follow our socials. I will put links in the comments after the show, so just stand by for that. But more importantly, there will be a link for our giveaway. We're having a 10K giveaway to celebrate my personal page exceeding 10,000 followers. We're giving away $100 cash and some journals. So make
Hey,
sure after the show you look for those links in the comment section.
right.
Okay? Because I want all y'all to enter, right? But also, 365 days a year, Always Up Coaching gives 1 hour of free life coaching to everyone. And I want you to have an hour. So go to alwaysupcoaching.com, click book a free discovery appointment, and you'll make an appointment with me in which we will talk about whatever you want to talk about. I'm going to send you a little form to fill out so we can make the most of your time and I can know a little bit about you before our appointment. And we're going to talk about your aspirations, your goals, your dreams, your struggles, whatever you want to talk about in that hour. And you will leave blessed and enriched and hopefully as a new client. But if not, I'm going to give you a ton of resources before you leave my 1 hour of care. Okay. So make sure you book your appointment today. That is probably the best thing you could do for your self-care today is to book an appointment with me. But anyway, to jump into it, last week as a recap, we talked about we introduced the topic of self-care and what self-care is and the different elements of self-care. We talked about learning to love and embrace your individuality, trusting yourself. We talked about loving your physical, loving your physical self, loving your emotional self, loving your um, spiritual
Spiritual stuff.
self. Yes, yes. And I'm missing one. Loving physical, emotional, spiritual, and there's another one in there somewhere that I'm missing. But
I can't think of
today we're
it.
going to kind of focus on loving your physical self, okay? So, what does that mean? That can mean a ton of things, y'all. Um, but in a nutshell, it means taking care of your body, right? And what is your body? Your body is this shell that we live in here on Earth that carries us from place to place. It's composed of various systems, right? We have skin, the musculoskeletal system, the skin, the integumentary system. We have a digestive system. We have a cardiovascular system. We have a nervous system, which means our brain and all the nerves that run away from our brain to keep this body moving and perceiving around us. So it is the very basis of self-care, taking care of our body. It's important that we have a healthy body in order that we can engage in the other aspects of self-care, right? So, Laverne, if you had to guess or you had to choose the most important aspect of physical care, in your opinion, because some of what we say is fact, but some of what we say is opinion, and based on personal life experience, what would you say, in your opinion, is the most important aspect of physical self care?
Actually, Tanya, I believe it would be two. It would probably be exercising and eating right would be my main um important physical care reasons is eating well and maintaining exercise.
Absolutely, I agree with that. Um, we have to have energy, right?
Yeah.
We have to have energy and we have to have something that's going to keep the energy flowing throughout our body. And the exercise, it exercises our heart. Yes, we build muscle, we burn calories, we stay lean, but the cardiovascular system is so important because we all know what happens when our heart stops, right?
Right. Right.
So it's important that we get in that. I think the most recent recommendation is at least 3 times a week for 20 minutes, getting our heart rate to a point in which we are
Mhm. Mhm.
exercising our cardiovascular. And
Right.
a good rule of thumb is, for your maximum heart rate, you can calculate 220 minus your age. And then you take that number and multiply it times about 75%, give or take.
Right.
And I think
Right.
the minimum is 60%. And that's where you want your heart rate to get to ensure that you're doing a cardiovascular level of exercise, right? If your heart rate's
Right.
not above that, you're not ensuring that you're exercising your heart in a very
Right.
good way. So that's a good rule of thumb. So, what kind of things can we do for exercise? Who?
Okay. It's a number of things. And I'm sorry, I was going in and out. I think it was something dealing with my internet service. But it's a number of things with exercise. Like I told you, you got to kind of reframe your mind with exercise. I know especially for me. I like to turn on music, I like to dance, I like to go for a walk. Start small, do something that you like to do. I
Mm-hmm.
wouldn't, if you're not a person that normally exercises, I wouldn't hit the gym, day one. Start doing something you like to do and work up to that, and start small, time
Mm-hmm.
wise, and work up to that. Jump
Mm-hmm.
rope, that was another one that I would like to do, but it's numerous things. Just get up and get moving. Don't sit on the side watching TV all day. Just get up, even
Mm-hmm.
if you're in your living room, just walk in place or turn a video on. There's so many things available, to promote physical, wellness.
Absolutely, absolutely. Um, Anything that gets your heart rate up. So,
Right,
even like for some people, vigorous yard work, getting out in the yard raking vigorously for 20 minutes, 30 minutes,
right,
or more, depending on what you have
right,
to rake. Some of us
right.
who, grew up in the rural areas,
Hmm.
we've
Working
had
in
a
your
lot of
garden.
raking to do.
Right.
Hmm. Yeah, hoeing
Running
your
behind.
garden,
ex-
planting, bending, squatting,
exactly.
moving around.
Running
I
behind my
think we,
grandchild, for one. He's here now. So I
oh,
don't know if you keep seeing
absolutely,
my eyes go off the screen. I'm trying to keep an eye on him, but that's
absolutely.
definitely keeping me physically active.
Hmm. Hmm. So I'm gonna take a moment. One of our co-hosts, Miss Lacole Smith, is in the comments section. She's saying good morning. Good
Good
morning,
morning,
Lacole.
Nicole.
Miss Vicky Lacole Smith, author of Leaps of Faith. Um,
Yes.
so she's under the weather, y'all. That's why she couldn't join us today. So y'all send your thoughts and prayers toward her for a
Yes,
speedy recovery of pneumonia. And we're really thinking about you, and
uh,
we're missing you today, Vicky. Or
definitely.
Nicole. We'll call her Vicky sometimes because
Yeah,
back in the day that's what we called
interchangeable.
her.
Right.
But she is Nicole. But back to the exercise. I think a lot of times we make so if we make it, most people make excuses as to why they cannot exercise, right?
Mhm. Mhm.
So, but you brought up a good point a minute ago. Playing with your children can be exercise.
Right.
Um,
And at the
so,
same time, you're getting that quality time with with your
mhm,
child. So.
yes, yes.
Mhm.
Um, there's a concept of and it's a newer concept, and it's a concept that was born out of the tech industry, and it's called gamifying. And what it means is turning everyday things or tasks into a game in order to positively reinforce you re-engaging in that behavior, right? So we can gamify exercise by um, coordinating it with or tying it to something that we have to do. One of those things that we make an excuse as to why we can't exercise. For example, bringing our kids to the park so they can recreate and get exercise. We can spend that time getting exercise as well. Or cleaning our house, doing housework. What can we do while we're washing the dishes? We can jog in place intermittently to keep our heart rate up.
Right.
Um,
Or do
we can,
squats.
exactly. There's things we can do.
Because
And
a
the
lot
thing
of
is, once you
times
mm?
Right.
Go
A
ahead.
lot of times, Tanya, we put in our head it has to be a certain activity, or we have to have
Mhm.
time, this time slot,
Absolutely.
cut out to just exercise. But just like
Mhm.
you're saying, you can multitask and do include those activities in. I like that gamify.
Yes.
I didn't know.
Gamifying, and you can do
Yeah.
that to
Okay.
anything, really. You can
Yeah.
gamify any activity.
Okay.
Um,
Okay.
Another thing would be like, once you get your heart rate up, you can start by getting your heart rate up by like jogging in place. And after that, it doesn't always take much to keep it up, right? So, if you're doing something that is not very vigorous, every 10 minutes, 5 to 10 minutes, stop and run in place, to get that heart rate back up to where it needs to be or to
Right.
maintain it where it needs to be.
Right. And
So
to
there's,
go.
go ahead.
I'm sorry to cut in.
That's
I
all
just
right.
thought about it, and to
We both have
monitor
so much to
that.
say on this topic.
Right,
Hmm.
and to monitor that, it has different apps on your phone. So, if you're
Hmm.
someone that can't keep up with what your heart rate may be, you can download an app. And I think
Hmm.
iPhone has a health app that's
Hmm.
already available that will monitor,
Yes.
your heart rate. So,
Or your steps even. That's a good
exactly.
example of people
Mhm.
gamifying physical activity, monitoring their steps on an app, wearing some kind of e-watch in which they can monitor their steps, their calories, their minutes of exercise. That's an example of applying gamifying to your lifestyle. So, when it comes to if you're having a difficult time, that's one way that you can increase activity in general, but also have a way to monitor your heart rate as well. But yeah, the more you're sedentary you are on your day-to-day activities, I would suggest you need to exercise even more. That's the minimum standard is 3 times a week for 20 minutes. But obviously, the more sedentary you are, the more active you need to be in your downtime in order to balance that out. And a lot of what we talk about today will be maintaining a balance in your lifestyle in order to ensure that you're healthy. Your physical body is healthy and taken care of. So let's jump over to diet. I talked about burning calories a second ago. Um, One of the things we struggle with in the US is calorie dense foods. Oh, and so Lacole just added that while sitting, you can still exercise, which is excellent. There's things you can do to stretch your body, move your body, create a calorie burn while you're sitting. They actually make these little pedal bikes that you can put under your desk now. They make standing desks now, right? They make
Right.
treadmills for standing desks. There's
Right.
so many things you can do to remain active, and
Exactly. And
there's really no excuse not to
right.
be.
And Latanya, let our guests know, if you don't exercise. I know weight gain is a risk, but remind them of different things that can be potentially at risk for if they're not exercising. Because I think about the tin man, the tin man that's rustying up if he's not moving. But
Yes.
remind them on what potential risk can happen if they're not exercising.
So if you don't exercise, things happen in your body. So we all start out as children, correct? And we're active as children. We're playing. We're fit. We by nature know that we need to move around as children,
Hmm.
right? When we become adults and we have jobs, we make excuses not to do it. And we have other things that are non-physical that interest us, right?
Hmm.
So what happens as you age and you exercise less, you start to lose muscle mass,
Hmm.
and that muscle mass, if your diet remains the same, is replaced with fat, right?
Hmm.
Because less muscle means you're burning less calories. So
Hmm.
that muscle mass is being replaced with fat. Um,
Hmm.
Also, if you have less muscle, it can also affect your level of bone density, right?
Hmm.
And your bone density is the very structure of everything, right? If your bones start falling apart, everything else starts having problems as well, right?
Hmm.
Your
Hmm.
nervous system has problems. For example, if you're losing bone density in your spine, you can have problems with, your function and your sensation.
Hmm.
You can have pain. Um, so as you lose the muscle, your basal metabolic rate, what burns the calories, is going down because you have less muscle. You're going to gain more and more weight over time if you don't change your diet, right?
Hmm.
And that's balance too. You have to look at, you know, at my age, I can't eat the same that I did at age 21, right?
Right.
Because at age
Right.
21, I was at, or probably 22, 23, 24, I was at peak physical, right? I had peak muscle mass, right? Peak bone density. I burned more calories, so I could eat more, right? Plus, I exercise more. I really dedicated a lot of time to exercise, so I could eat more. So you have to balance your food intake to go with the way your body composition is, right? So now that I'm older, I can take in very few calories, unfortunately, right? So I have to be mindful and perform self care by being mindful of what I put in my body as well. So, when you talk about balancing your diet for self care, you're talking about the calorie burden, but you're also talking about the nutrient balance, having a balanced diet in order to get in the adequate nutrients you need. And we talked last week a little bit about the building blocks of different neurotransmitters. So those nutrients are not only to perform the daily functions that you need to live, to work your body, right? And have energy to move your body, but also to produce the things you need to function normally physically and emotionally for mental health, right? Um, what else can you add about nutrients, Laverne? Is there any have you ever been a vitamin taker or a supplement taker?
Yeah, I definitely take my vitamins and try to maintain a balanced diet. Just like you said, we're not getting younger, we're only getting older. So it's
Mhm.
very important, to maintain those nutrients because certain deficiencies with changes with age can be very detrimental to your health. So
Mhm.
it is very important to make sure you're getting the right nutrients in along with the enough exercise. Um, because as you get older, your body can get possibly weaker. So, and you're prone to a
Absolutely.
lot of other diseases. So, if you maintain that nutrition status and, you're exercising, it can, combat some of those things and possibly
Mhm.
slow those things down. Me
Mhm.
myself, as nurses, they're always considered the worst patient. And
Mhm.
I was just talking to someone the other day. I'm bothered with my hip a lot, my right hip, and I went to the doctor. They're telling me I have to have a hip replacement, and I'm not an old person. I don't consider myself as being really old, and I don't consider myself as being really young, but just I've changed my diet altogether because I started having like severe pain. It just started depressing me, and I changed my diet altogether. So the pain alleviated. Like I can honestly say that you know what food is medicine at that
Mhm.
ass point because I went in,
Yes.
I got lab work done, and I was like, what was it, vitamin D deficient, and that affects your
Mhm.
bones.
That's
Um,
very common in modern times because we spend so
right.
much time inside now.
Exactly, exactly. So I started taking a vitamin D supplement and I changed my diet around. So it is helping improve my mood and improve my physical abilities. So I would say physical exercise. So I'm moving more, I'm eating right, so I'm feeling better. And if I feel better, I can get out and do things, with my family and do things for myself because I'm just getting older. And if I don't keep this up, I won't be able to do nothing for myself nor my family. So, it's very important.
Mhm. Absolutely. I actually had to start taking prescription vitamin D because my vitamin
Mhm.
D level is chronically low.
Yeah,
And I've shared before with y'all that I have an autoimmune disease, and vitamin D is at the very heart of your immune system, right?
right.
So part of taking in those nutrients is having a healthy immune system, and we know that better than ever after the pandemic, right? How certain vitamins were recommended to be taken in light of trying to stave off illness um, related to the pandemic. Um, I will also say, a good multivitamin never hurt anybody.
Hmm.
Now, we don't, doctors will tell you, you're not going to absorb all of the vitamin, right? But if
Right.
you are deficient, your body knows what it needs to absorb and how much, right?
Exactly. And
So better safe than sorry, right?
right. And couple that with your water intake. You want to make sure
Mhm.
you're drinking a lot because dehydration, and you're not, getting the proper nutrients, that can be
Mhm.
another factor that plays on your health.
Absolutely, absolutely. So, nutrients, water, and a good and I actually just spoke to someone about water earlier. I got a phone call from a family member, saying that something was going on and they thought it was
Mhm,
this and they were on the right track or whatever. So I gave some
mhm,
some advice. And one of the things piece of advice I gave, we often go by the 64 ounces a day water rule,
mhm.
which is based on a 150-pound person, really.
Mm,
It's
I didn't know
not
that.
based on everybody. And
Wow, I
I
didn't know
remember
that.
being pregnant with my first child and dealing with dehydration because I
Mm,
don't get thirsty usually. I only
yeah,
realize I need to drink is if I'm talking a lot, like now, and I
yeah,
get hoarse,
that's me. Mhm,
or if my mouth gets dry or my lips get
mhm,
chapped. I'm like,
mhm.
how much water have I had today?
Yeah,
So I have to really actively force myself to drink.
yeah.
But a good rule of thumb for calculating how much fluid intake you need, and I say fluid intake because sometimes we drink other things that are
Mhm,
close enough to water where we can count those things when we're looking at the
mhm,
big picture. Obviously, we want the majority of what we drink to be water, right?
mhm.
We don't want to be going in on Diet Coke all day, every day, right?
Right,
But
right.
if it's a non-caffeinated drink that is not overly sugar dense,
Mhm,
um, you can kind of count that as fluids, right? But a
right.
good calculation for determining if you have enough water intake is half of your body weight in pounds, right?
Mhm, mhm.
So some of us are going to think about that number and be like, "Ooh,
That's a lot of water.
that's a lot of water," right? But
Right?
think about it. If you have more body to circulate, you need more
Mhm.
volume in your circulatory system. So you're going to need to routinely take in more fluid in order to circulate those things like nutrients, correct?
Yeah, right.
Yeah. So that's another aspect of maintaining a balanced diet. I want to talk real briefly about supplements. And I mean supplements outside of vitamins, right? Or building blocks, so to speak. So we're talking about herbal supplements, or you can count as a supplement. Sometimes we have recommendations to take mega doses of certain vitamins, for example, vitamin C, in order to stave off cold and flu viruses and stuff like that. I would count that as a supplement because you're not just supplementing, you're taking it in a very large dose. Um,
Yeah, and that's big since COVID.
So, like, there was a recommendation, I think, for zinc, but also, um, I am a believer in herbal supplementation, but I am a believer in knowing what you're putting in your body and where it's coming from, right? So, if you want to supplement a herb, do research on the herb. And research is not reading so and so's blog, right? Research is involves, maybe going to the CDC, some governmental agencies that can really talk about um, balanced diet and supplements, looking for warnings about it, looking for drug interactions, talking to your pharmacist. You may have some prescription drugs that are not going to interact well with the various supplements. So, a very good resource is talking to your pharmacist because the pharmacist has this big book that they can look up, compare with your prescription drugs. And you can talk to the pharmacist about, you don't have to be on prescription drugs to talk to a pharmacist. Go to any pharmacy and say, "Hey, I'm taking this. Is there any side effects I should be aware of? These are my medical conditions." And they will give you some information. They will refer you back to your physician, right? Because they don't want to be giving medical advice, but they can educate you about that herbal supplement, right? So, for example, you can be on no prescription meds at all and be taking certain herbs, right? And imagine you're going for a routine elective surgery, right? And they ask you, do you take any meds or supplements? And you forget to tell them something. There are actually herbs that will thin your blood, right? And that can actually cause complications during a medical procedure, right? So you need to know what you're taking and understand the implications of what you're taking and know how important it is to have a good knowledge of what you're taking. So when situations like that happen, it'll be at the forefront of your mind to mention that you take herbal supplements to a provider. Um, Things I've taken before is guarana and ginseng for energy. Those are actually popular ingredients in a lot of energy drinks. Um, I remember taking those, in the 90s, for the first time. Even when they weren't, there were no energy drinks back then, like talking about it. But Other supplements might be echinacea. Echinacea is very good for the immune system, so it's in a lot of teas. Echinacea is. I actually right now have a sleepy time tea that I use that has echinacea in it, and it's just a regular supplement. And a lot of times, these herbs, some of the things that they're giving you is actually nutrients.
I never
We're
had
talking
the
about green
echinacea one.
leaves.
Sounds good.
Usually, they mix it with some kind of minty tea of some
Like
type.
chamomile, I like the chamomile tea at night. It's really
Absolutely.
good. Yeah.
I think this is a good transition into sleep, right?
Yeah, it
So that's
is.
another way of giving yourself self-care, getting
Yeah.
adequate sleep.
Yeah. Sleep
Um,
hygiene is very
mhm.
important. We talked about
We
that
talked a
before.
lot about sleep hygiene last week and keeping
Mhm,
a regular routine. Caring for
mhm.
yourself often involves some discipline, right?
Exactly.
So keeping a regular routine for sleep is
Right.
important. Only sleeping in your bed, don't
Right.
do s- work in your bed, because your
Right.
bed, you want to trick your brain to know that anytime I lay on this mattress and cover up, it's sleep time, right?
Right.
So
And I don't know that our viewers know inadequate sleep also has a part in blood pressure control. So if you're dealing
absolutely.
with elevated blood pressures, and you're not getting enough sleep, you need to look at your sleep hygiene because it can be a reason why your blood pressure is going up along with other factors.
Absolutely, absolutely. I won't get too deep in sleep hygiene because we did discuss that a bit last week. So go watch
Mhm.
last week's episode to get
Right.
learn more about sleep. But
Right.
I will reemphasize that sleep is a very person specific thing. Some people
Mhm.
need more of it than others. It's very
Yes.
genetic and lifestyle specific,
Right. Right.
right? So you need to kind of play. If you're not sure how much you need, just kind of play around with it.
Exactly.
Start out with the 8 hours. And if you feel that's adequate, but you don't want to sleep that much,
I
you
don't
can back
know.
it off a little bit and see at what point you have less.
In
I
this
think I'm
day
an 8 to 10
and time,
hour lady
I
myself.
I am also Latonya, but in this day and time,
Hmm.
I think it's a lot of people that
It's
aren't
very
able,
difficult.
they're so busy they can't get
Hmm.
in that actual full 8 hours of sleep. But
Hmm.
you maybe
I
if you
don't know
can.
if Laverne, you ever read the book Miracle Morning?
I hadn't. I No, I hadn't. Mm-mm.
He actually in his book he talks about your sleep is what you think you need, right? And
Mhm.
it's a very individual and it's very mind driven.
Mhm.
And
Mhm.
and he actually promotes kind of going by instincts as far as what you need and
Mhm.
starting off with a lower amount of sleep and seeing and working your way
Mhm.
up
Mhm.
as you get to the amount you need.
Right.
On average, I would say I get about 6 hours of sleep.
Mhm.
And in my mind, and I think part of it is just programming over many years of me thinking I need 8. I
Mhm.
never think
Mhm.
6 hours is enough,
Right.
right?
Right.
But
Uh
there's
huh.
been many times that I've gotten 6 hours of sleep that I've
Function.
functioned very
Yeah.
highly throughout the day,
Exactly.
right?
Yeah.
And I think it all comes to balance. Like 6 hours of sleep may not work if you're not eating right,
Mhm.
right? If you're not
Exactly.
exercising, if you don't
Exactly.
live a otherwise balanced lifestyle, it may
Mhm.
not be enough. You may need extra.
Right.
If you're overstressed, if you're working a job that's requiring you to do a little bit extra and is stressing your body, 6 hours may not be enough.
Right.
But
Right.
in some cases, 6 hours may be absolutely
Yeah.
adequate.
So
So
right.
it's
Mhm.
very person dependent, activity dependent, lifestyle dependent, right? Stress level dependent, right? And obviously, stress is something we need to talk about in this conversation too. Um, so we'll talk about that next. But you can start with a lower amount and then go up, But I know how it is when particularly you're a parent, right? You come home from work, you got to do the homework and all the things, and that's not including if maybe somebody has some kind of you know,
Mhm. And
after
a good.
school routine
Right.
that they do, right?
Right.
They're playing a sport or doing some kind of extracurricular after school. It's
Right.
not even including that time, but you do all the things and now it's 9:30, right? And you got to get
Mhm.
ready for the next day, and try to, do the things that you need as a parent, right?
Parent to do.
And now it's
Exactly.
11 p.m. and you have to wake up at 5, right?
Yeah.
So there's
Hard.
times in my life that that's all we can
Mhm.
get. Like literally that's all we can get is the 6 hours. Um,
Right.
so it's good to be mindful that we may not be getting enough, especially if we are symptomatic, right?
Mhm.
But
Mhm.
also on the weekend, if you're a Monday through Friday person, hey, I'm gonna sleep in a little bit late. I'm
Right.
gonna give my body more time to relax today. I'm not gonna put in 8 hours of housework today. I'm only
Mhm.
gonna put in four and just kind of vegetate a little bit, right? Because I've been so active throughout the week. And
Right.
that's where we talk about that balance.
Yeah. And
So
like you
go ahead, Laverne.
And like you said, it's very important to discipline yourself because a lot of times know how we stay up watching TV, that dopamine, feeding
Hmm.
that dopamine. You want to make sure discipline yourself because if you're noticing yourself yawning, getting sleepy in the daytime or doing like, or even driving, because I know before, because I make it a my business to get 8 hours of sleep every night. And but before, like I said, I would be able to function on 6 hours of sleep fine. But I notice if I'm just sitting still, such as driving, um, and I'm feeling really drowsy. So I'm like, this can
Hmm.
be dangerous. So if you're noticing that you're doing stuff like that throughout the day, you need more sleep and you got to make it your business to get more sleep because it can be detrimental.
Absolutely. 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 It could yeah, it could be have very detrimental consequences. I'm a
Right.
registered nurse, and over the course of my career, I've heard several stories about nurses going to sleep on their way home
Mhm.
from work and
Right.
killing themselves in a car accident, and
Exactly.
possibly injuring other people. And so
Exactly.
it's very important that we are not knowingly going without sleep.
Mhm.
And I've made that mistake in the past, say,
Mhm.
I'm gonna get off work and I'm gonna go do XYZ or whatever, whatever, whatever,
Right.
and I'm just gonna push through. I'm gonna push through because it got to be
Mhm.
done,
Mhm.
right?
I have.
And I remember being on the highway, like,
Yeah.
music blaring, windows down, and
The
thinking to
same.
myself, I'm going
Right.
to be all right. I just need to make it through 20 minutes of this, right? And it's
Right.
just not a safe thing. And I don't do
It's
that
not.
anymore. I just
It's
don't
not.
make a habit of doing that anymore.
It's not.
And I can't remember the last time I've done it. Thank God I've matured out that thought
Yes.
process of thinking that anything is so emergent that I would risk my
Right.
life
And
on
you
the
know
highway.
that sleep deprivation affects your decision making process.
Oh, absolutely.
Yeah. So you
Mm-hmm.
thinking, okay, I can make it through this 20 minutes of driving. You already sleep deprived, so you're not thinking clearly at that moment. And I saw a study where I think where did I see that study? Police pulled over several drivers and did a breathalyzer test, and they tested high as if they had alcohol in their system, but they were actually sleep deprived. I thought that was
Wow,
interesting.
wow.
Yeah.
Yeah, when you're sleep deprived, your body starts metabolizing differently, right?
Mhm.
I
Mhm.
know when I'm severely sleep deprived, one of the things that happens is I get nauseous.
Mhm.
I start having stomach ache, I get nauseous, and that's
Mhm.
because my GI tract is shutting down, right?
Mhm.
So if you think
Mhm.
about it, a lot of the way you metabolize things is going to change because like you're going to have the acid level in your stomach's going to change, and I
Mhm.
think that's where a lot of that alcohol metabolism is coming through because the acids in your stomach is changing, and it kind of
Right.
tricks the breathalyzer a little bit. But also
Exactly.
you're blowing out different types of gases in your breath
Mhm.
when you
Mhm.
metabolism changes. Um, so yeah, rest and sleep. So there's sleep, getting hours of sleep, but there's also physical rest. You
Mhm.
got to have times when you're physically doing nothing, especially if you for your job, you do a lot of physical, right?
Mhm.
Now, physical activity is good, right? And we talked about balance, but still, if you're on the high physical job side, you got to have that balance of low physical, right? So and I think, when I worked nursing jobs in which I had a lot of standing, walking, doing, flipping, turning, lifting, I have neglected to do nothing, on some of my off days. And sometimes my body gave me no choice, but I've neglected. And so let's talk about stress levels. How important is it to manage your stress? Because life in general is stressful, and stress is a normal response to a situation. But how much is too much? How would you answer that question, Laverne?
How much is too much? It's too much is when it's affecting your health,
Mhm,
affecting your relationship with others. And that's
mhm,
when I feel that stress is too much.
mhm. I would say the same thing. If you are symptomatic, you're getting headaches.
Mhm.
Um, specifically those headaches that creep up the back of your neck,
Mhm.
and radiate
Mhm.
around those tension headaches.
Mhm.
Um, if you're getting sick to your stomach because you're so
Mhm.
stressed,
Mhm.
that's a symptom that there's too much stress. But sometimes I will mention that sometimes stress does not show up physically in people.
Mhm.
In a perceivable manner. Sometimes your blood pressure, as you said, just goes up, right?
Mhm.
And how would you know it's going up unless you have a blood pressure meter at your home or you're seeing the doctor regularly?
Right.
Those are the only ways you can know that your stress is impacting your health,
Mhm.
possibly, right?
Right.
So let's transition that into seeing a doctor. Self
Mhm.
care is seeing, getting routine health care, right?
Okay.
So going
Exactly.
to the doctor to actually get those yearly labs or
Mhm.
bi-yearly for some people labs drawn to make
Exactly.
sure there is no evidence of disease process or anything going on in your body, right? Going to the doctor to get the screenings done, the colonoscopies, the mammograms, all those things that you need to do on a routine schedule. That is a part of your self care. Um, Taking your medicines apps prescribed. I take a few things every day, prescription wise, and it's always a struggle for me, if I break my habit or my routine, right? As far as maintaining a regular schedule for taking my medicine. So, but it I'm not doing myself a service. I'm doing myself a disservice by not taking my meds the way they're prescribed, right? Because first of all, they're not going to give me my full effect. Second of all, it can appear that they're not working, but I won't know they're not working unless I'm taking it as prescribed, right? And for some of my meds, it can have long-term consequences of not taking it routinely over a period of time, right? So part of my self-care is ensuring I, first of all, keep my meds filled so they won't run out, but
Mhm.
then also taking them as prescribed. And
Right.
another level of that is communicating with my healthcare provider when I feel like I don't want to take the medicine anymore to see if there's any
Exactly. That's
alternative.
very important. That's very
Coming up with
important.
a plan.
Mhm.
Laverne, do you have any tips for communicating with a healthcare
Uh,
provider?
Communicating with the healthcare provider is very important. When I worked in the hospital, I always had these little old ladies or little old men that would come in, um, stop taking their blood pressure medicine over the weekend or over a extended period of time because it was making them feel bad. Now they're in the hospital with a stroke. So,
Mm-hmm.
only if they would have communicated with their provider on how they actually felt, the doctor could adjust it, their medication, and they wouldn't be at that point. Even communicating with your provider about the price of the medication,
Mm-hmm.
because there's a lot of times, we're put on medication, we get to the pharmacy, we can't afford it, or
Mm-hmm.
can't get it at that time. A lot of the doctors have they have samples that may be available, they have coupon cards that may be available. So just communicating it with your doctor or just asking them, hey, is this a really expensive drug, or hey, could you check if that this drug is covered by my insurance,
Mm-hmm.
because it's always an alternative drug that they can put you on, then. So just communicating that and not waiting,
Mm-hmm.
until something happens, and
Mm-hmm.
you know, or you going back to the ER because you didn't get your drug, your medication,
Mm-hmm.
for issues. So that's very important, communication, keeping that communication open. And even if
Mm-hmm.
you call the doctor's office and you can't speak to the doctor, ask to speak to that nurse. She can be
Mm-hmm.
your advocate for that. So that's very
Absolutely.
important.
And these days, most physicians, um, particularly if you're involved in some kind of health system, like in Baton Rouge, we have Our Lady of the Lake Health System,
Hmm.
we have Ochsner Health System. They have technology such as MyChart, in which you can actually physically or digitally send a message to your provider. And sometimes it's easier to voice your concerns when you could have time to take your time, type up what your concerns are and send it over versus when you're in the doctor's office and it appears like everybody's rushing, right? And you don't think you have time to communicate, or maybe the doctor didn't give you time. And that, kind of ties in with, sometimes we need to change healthcare providers. That is self-care. If you feel like you're not being listened to, even when you make the effort to communicate, if you feel like you are not being allowed to be the leader in
Right.
your healthcare planning.
You have to advocate for yourself,
Yes, you do.
definitely.
You do. You have to advocate, but then if your advocacy is not working with that provider, change providers. I
Right.
know for some people it's very hard given the type of insurance or healthcare
Mhm.
they have. However, what would be very hard is you knowing that something's wrong with you, it not being addressed, and then you
Yes,
having
not
some
being
adverse
heard.
outcome, right?
Mhm.
So do
Mhm.
due diligence and care for yourself
That's very
enough
important.
to change providers. There was a time in my life where I had to do that
Mhm.
because I wasn't being listened to. I had to go,
Mhm.
from one provider to another, till I got
Mhm.
somebody who listened to me
Right.
and got somebody who took my concerns seriously. Till
Mhm.
I got somebody who cared about my quality of life and not just
Mhm.
looked at my lab numbers, my blood pressure, and said, "You're good." No, I'm not good because I don't feel good. My quality of life is suffering, right?
Right. Right.
So be your best advocate. And an advocate is somebody who's going to go to battle for you, right? That's your your champion, right? Sometimes we're excellent at being a champion for everybody else,
Mhm.
but we're very poor at being an advocate for ourselves, right?
Right. And another thing I would suggest with that, before you go to the doctor, sit down and write some questions down. Because a lot of times when we get in there, yeah, you
Mhm.
feeling rushed, but sometimes you forget, when you get
Mhm.
in there. So have those questions prepared on what you want to ask that doctor concerning your
Mhm.
health. And have him address each question and explain to you. It's very
Mhm.
important because they're working for you ultimately.
Mhm.
I don't
Yes,
care,
you're
what
paying them.
insurance you may have, but they're working for you. So
Mhm.
you want to be satisfied with how you're being
Yes,
taken care of.
absolutely. Um, Sometime in the distant future, we'll do a episode on advocating for your health because I know that is a struggle, especially in certain populations in which you aren't listened to. Women, people of color, people who have a disability, obese people. These are all groups in which we have a harder time communicating with our providers and getting the provider to listen to us because of unconscious bias. But in the future we'll have an episode in which we go dive deeper into that concept of the different things you can do to get your provider to listen to you. But one quick tip I will give is definitely use the my chart, for example, or my chart or other digital communication platform you have. I have an appointment on Monday, and one of the things I did was I one of my medicines have been on back orders through the pharmacy. I communicated with my providers like, hey, this is going on, whatever. When I come see you on Monday, let's talk about alternatives, right? And that way you won't forget the day of, right? Um, but also, it'll let them know that you are thinking about these things, right? You are concerned about your health, right? But also, the other thing I do is when I arrive to the doctor, I will, like Laverne said, write things down. And I will have a copy for myself and a copy for them. The copy for myself is typically on my phone, right? Of the things I need to talk about, right? But if I have it bulleted on a piece of paper that I could pass to the medical assistant or the nurse that checks me in, the doctor gets to see it before they come in my room, right? And so they're coming in prepared to discuss these things with you and knowing so you're not having to find a way to squeeze it into the conversation as they begin asking you all these questions that they have to ask in order to do their jobs, right? So that's a helper, a little tip to communicate with your care provider. So let me look at I think we covered most of the bullet points we had on our notes here, but let me open it up to make sure we talked about everything we wanted to talk about today with y'all. Yep, yep, yep. So this is the last thing I'm going to talk about. And when you're having a difficult time um, taking care of yourself physically, one thing you could do is get help. You can get help from people. And that can come in the form of a parent, a sibling, a significant other, or a coach. So sometimes we do struggle because so many things are going on in our lives. We cannot remember even to do the things that we need to do to take care of ourselves. One thing in the past that I've done is I've struggled with making appointments, so I will, tell my mom, remind me to make this appointment, check with me next week to, hold me accountable for making this appointment. Because sometimes we'll remember, but because of what's going on in the moment, we will not prioritize it,
Right.
right? And
Mhm.
we really do need to actively prioritize our physical health, y'all. I mean,
Right.
it is what it is. Nothing else can optimally function unless we prioritize our physical health, right?
Exactly.
So get with that person. Say, look, I've been doing a poor job of taking care of my body. I need a somebody to hold me accountable. Accountability partner. That's what I call it. An
Right.
accountability partner to make sure that I'm going to the dentist regularly, going to the doctor regularly.
Mhm.
Taking my prescription drugs.
Mhm.
Ask me how I'm eating, right? And sometimes an accountability partner is not someone there to like wag their finger at you and say, you're not
Mhm.
doing. It's just something,
Mhm.
somebody to remind you that you came to me because you were, you
Mhm.
thought your health was a priority.
Right. Kind of
So
bringing you
I'm
back to that why. Mhm.
exactly, exactly. That's exactly what it is. They're bringing you back to the why, right? They're not there to punish you, make you feel bad about yourself. They're there to remind you that you are important to
Right.
yourself, right? So get that accountability partner. That's something that I've actually, done with my life coaching clients is how's your health? Do you see the doctor regularly? Because nothing I do with them as far as, helping them, go after their dreams, go back to school, build a business, learn to communicate better, learn to be a better leader, all the things I help people with, they cannot efficiently do those and do them at the best of their ability if they're having headaches every day,
Right.
if they have a hard time doing things because they're not taking their medications as prescribed. In
Mhm.
order to function optimally, their body needs to be healthy. So that's one thing I actually do with my clients as well. So we're coming up on an hour. You have any final words for everybody, Laverne?
Um, I was making a couple notes as we were talking. Just a couple of things I wanted to cover when you talked about supplements, Latanya. I think a good thing to also think about. You're talking about researching different supplements and whatnot. Is food, looking at what's going in your body food
Hmm.
wise, looking at the
Hmm.
labels, reading the labels, seeing the fat content, the carbohydrate, the amount. So it's very good to read those labels when you're especially dealing with processed food. If you're taking a lot of prepackaged and processed food, to just start reading those labels and make it a habit and research. I looked at, is it a blood type diet that I think we talked
Yeah.
about once before? That's
Hmm.
really good. But it's a book called Dieting for Your Blood Type, and it's a lot of good
Hmm.
things. Like certain blood types might want increased vegetables in it. So look into that and read the
Hmm.
labels. I think that's very important when you especially with nutrition and self-care.
Hmm.
Um also I was thinking about your physicians. I know my parents have multiple physicians that they go to. I know a lot of elderly patients have a lot of physicians they go to, and sometimes those physicians don't communicate amongst themselves. So that's
Hmm.
also a good part of advocating for yourself is like Latanya said, write those questions down, keep your medication list. If you saw this physician here, bring that to that other physician's attention, so everyone can be on the same page because we would like to think in a perfect world that our physicians are communicating amongst themselves, but in
Hmm.
reality, they're really not.
They're
So
not.
I even found checking my mom's medication. She was prescribed the same medication with two different doctors, and it was
Hmm.
different names. I'm not going to say the exact same medication, but the medications did the same exact thing. So,
Wow.
and even if you have parents, pay attention to their medications, talk to them about their doctors and their doctor visits, and just review that with them, because if they're not communicating, how is that doctor going to know what, and a lot of times we go there and say, okay, we're taking this and this. Suppose you forget something that's on your list that you're actually taking,
Hmm.
and you don't communicate that with your doctor. That can be, that can put you at risk, or put your parents at risk. So it's very important to keep that line of communication open amongst your doctors. um I have nothing else to say, but wait, one thing I do have to say. I just thought about um
Hmm.
taking care of your physical self, allows you to show up as your best you, and just, remember, you only get one you. So you got to
Hmm.
take care
Hmm.
of.
That's right. In order to, like you said last week, in order to show up for the people in our lives, we have to show up for ourselves first.
Exactly,
You
exactly.
get on the plane, they say, before you help anybody else with their oxygen mask, you got to put your own oxygen mask on.
Hey,
Okay.
exactly.
So think of self care in general, but in particular, physical self care as
Mhm.
putting that oxygen mask on. Because if you pass out
Mhm.
for lack of oxygen, you can't help anybody else. Right,
Right,
y'all?
right,
And I
right.
think we're going to end on that note. I think that's a good note to end
Okay.
on, right?
All right.
So, this is the Self Care Saturday. And, this is where we talk about being selfish 1 hour a week, right? So,
Right.
come back, join us next Saturday when we'll talk a little bit more about being selfish. And in the meantime, I'm about to drop that link in the comments so you could join, you can enter the 10K giveaway for $100 cash or a
Awesome.
journal. Also, I'm going to drop in all of our social links so you can make sure to follow us so you'll never miss a Self Care Saturday. All right. Thank y'all so much for joining us this
Thank
weekend. We
y'all.
look forward to seeing y'all next weekend, and you
Yes.
enjoy the rest of your weekend and have a good week until we see you again.
Have an
Goodbye,
awesome week,
everybody.
guys. Bye.